What comes to mind when you think of healthy foods? For many, it's probably eggs. They're known for being high in protein and nutrients. But did you know that eating them the wrong way can actually be harmful? I'm Dr. Robert Peterson, and I've been an internal medicine specialist for over 60 years. I'm 92 years old this year, and I still see patients at a retirement home in upstate New York every Tuesday. People often ask how I'm still working at my age. Want to know my secret? Believe it or not, one of my health secrets is eggs. But I don't just eat them any old way. I eat them in a specific way. Today, I'm going to share an important story about egg consumption that I've learned from treating thousands of elderly patients. Eggs are likely on your table every day, right? But are you perhaps eating them in a way that, despite your good intentions, is doing more harm than good? I hope this story helps you find out. Please watch until the end to get the full picture. And while you're at it, please click the subscribe and like buttons so you can continue to receive even more health information. Hundreds of elderly patients come to my office every year. Many of them eat eggs every day, but their health is still declining. A prime example is 83-year-old Mr. John Smith from Chicago. He was hospitalized with salmonella poisoning after eating soft-boiled eggs every morning. At first, we thought it was a simple infection, but upon further questioning, we discovered that Mr. Smith had been eating soft-boiled eggs every morning for the past 40 years. Recently, he had even been eating expired eggs. His immune system was weakened by age, making a habit that was previously harmless a major risk. Our bodies change as we age. Eating habits that were fine when you were younger can become dangerous. In old age, eggs in particular are much more complex than we think. They contain various components, including protein, fat, and minerals. And the way these components interact with our bodies changes over time. In my 60-plus years as a doctor, I found that while eggs are definitely a healthy food, they can be either medicine or poison, depending on how you eat them. This difference is even more pronounced in old age. Do you eat eggs every day but feel like your health is declining? If so, my story today will be of great help. Let me tell you about 86-year-old Mrs. Mary Johnson from Kansas. She had been taking cholesterol medication for over 20 years and ate fried eggs every morning to get her protein. But her cholesterol levels never improved. When she first came to me, she was already on 3 heart medications and 2 cholesterol medications. She was exhausted by her dependence on drugs and asked for my help. When I asked about her eating habits, she said she was eating fried eggs early every morning for her health, and at lunch she only ate the egg whites while taking her medicine. At the same time, I taught her the egg-eating method I will explain below. Over the course of 3 months, she diligently followed it and was able to halve her cholesterol medication. In a recent examination, her numbers had dropped by nearly 30%. 6 months later, she also reported that her fatigue had decreased and her energy levels had returned just by changing the way she ate eggs. Isn't that amazing? You probably know how hard it is to change your eating habits, but my 60 years of experience have taught me that even small changes can have a big impact. What I'm going to tell you today may be even more effective than changing medication or undergoing major surgery. Now, the information I'm about to share is important, actionable knowledge that can determine your lifelong health. To truly appreciate the value of this video, please watch to the end. And while you're watching, please click the subscribe and like buttons. That one click may help someone live a healthy 100-year life. Please note, if you do not properly understand this information and apply it incorrectly, you could harm your health. Be sure to watch until the end before making any changes. If you've been eating eggs for your health until now, it's time to eat them the right way. Here begins the main part. 5 egg-eating methods you should absolutely avoid. Eating only egg whites on an empty stomach Many people throw away the yolk and eat only the egg white to avoid cholesterol, but this is a huge mistake. Egg whites contain a component called avidin, which inhibits the absorption of vitamin B7, also known as biotin. A lack of biotin can lead to nerve damage, depression, and fatigue. Biotin is especially important in old age. It supports the nervous system, skin health, and cognitive function. A deficiency may begin with fatigue, but can progress to numbness in the hands and feet, muscle weakness, memory loss, and even depression. Mrs. Eleanor Thompson from Maine developed severe numbness in her hands and feet due to this habit, and even had trouble walking. The effect is even worse on an empty stomach because stomach acid is more concentrated, which strengthens avidin's impact. What's more, in addition to cholesterol, egg yolks contain lecithin, omega-3 fatty acids, lutein, zeaxanthin, and other nutrients essential for seniors. Lecithin supports brain health, while lutein and zeaxanthin help prevent age-related macular degeneration. If you throw away the yolk, you miss out on all these benefits. Practice tip: eat the yolk and white together during or after a meal, not on an empty stomach. Egg yolks are rich in biotin, which helps counteract avidin's effect. Eating a small vegetable salad or whole grain bread before the eggs also slows digestion and improves nutrient absorption. If you're worried about cholesterol, 5 to 7 eggs a week is a good range. About 1 per day is safe for most seniors. If you're taking cholesterol medication, talk to your doctor. If possible, eat eggs in the afternoon. Dementia and Parkinson's patients should be extra cautious, as biotin deficiency can worsen symptoms. People taking certain antibiotics or exposed to environmental hormones are also more vulnerable. How have you been eating your eggs until now? Have you perhaps only been eating egg whites for your health? Eating raw eggs? Some seniors have a habit of drinking raw eggs with vodka or eating them soft-boiled. This carries a high risk of salmonella infection. In old age, the immune system is weaker, making seniors more susceptible. Salmonella doesn't just cause a stomachache, it can lead to severe dehydration, fever, or even sepsis, which is life-threatening and requires hospital care. According to the CDC, deaths from salmonella infections are highest among adults aged 65 and older. Another problem is that raw eggs interfere with vitamin B absorption. Avidin in raw egg whites remains 100% active, if not heat-treated, making biotin deficiency worse. Raw egg proteins also bind to beneficial gut bacteria, disrupting the balance of your microbiome. That balance is crucial for immunity and mental health. Recent studies even link gut bacteria to Alzheimer's, Parkinson's, and depression. 2-year-old Mr. Mark Thompson was hospitalized in the ICU with severe sepsis due to his lifelong habit of drinking raw eggs with vodka. After recovery, he needed prolonged antibiotic treatment, which caused chronic diarrhea and malnutrition due to gut imbalance. Practice tip: for safe consumption, eggs must be cooked thoroughly, at least 165 degrees T, 74 degrees heat. Boil for 9 to 12 minutes, until the yolk is solid. When buying eggs, check freshness and avoid cracked or stained shells. Refrigerate immediately and eat within 2 weeks. Always wash hands after touching eggshells. Avoid discount eggs near expiration. It's not worth risking your health for a bargain. Being frugal is smart, but fresh eggs are worth the investment. Do you enjoy soft-boiled or raw eggs? Maybe it's time to rethink that habit, starting today. Consuming eggs with medication. Many seniors take multiple medications, but certain drugs should not be taken with eggs. Blood thinners like warfarin, antibiotics, and iron supplements can interact with eggs. Warfarin's effect depends on vitamin K levels. Egg yolks are rich in vitamin K, so a sudden change in egg consumption can affect the drug's efficacy, either increasing bleeding risk or reducing its effectiveness. Antibiotics like tetracycline and quinolone can bind to the calcium, magnesium, and iron in eggs, reducing their absorption and making the medication less effective. Taking iron supplements with eggs can interfere with iron absorption. This is because the protein in egg whites binds with iron to form a complex that is not absorbed in the intestine. This is particularly important for older adults with anemia. 85-year-old Mr. Harold Smith was rushed to the emergency room with a brain hemorrhage after taking blood thinners along with eggs. The vitamin K in the eggs had reduced the effectiveness of his warfarin. Similarly, 76-year-old Mrs. Dorothy Jones suffered because her anemia wasn't improving, despite taking iron supplements alongside eggs. For safe consumption, it's best to leave at least 2 hours between egg consumption and medication. If you're taking particularly important medications, it's even safer to leave a gap of up to 4 hours. Be sure to talk to your doctor or pharmacist about any interactions between the medications you're taking and eggs. There are also specific precautions for each drug. Thyroid medications such as levothyroxine should be taken on an empty stomach in the morning. But if you eat eggs in the morning, wait at least an hour after taking the medication. High blood pressure medications and statin cholesterol medications should also be taken at least 2 hours apart from eggs. In addition, eggs can interfere with the absorption of calcium and zinc. Pay special attention if you're taking these mineral supplements. Calcium is essential for bone health, and zinc is vital for immunity. If you're taking supplements, do not take them with eggs. Consume them at a different time. What foods do you usually eat with your medication? Think about whether you have a habit of taking eggs alongside your medicines. Fourth, consuming eggs between 6 a.m. and 8 a.m. Many people eat fried or steamed eggs early in the morning. However, this is the time of day when our bodies secrete the most cortisol. Cortisol, often called the stress hormone, actually plays a key role in regulating our daily rhythm. It naturally rises as we wake up and falls as the day progresses. The issue is that cortisol promotes cholesterol synthesis in the liver. Between 6 a.m. and 8 a.m., when cortisol is highest, eating eggs can further boost cholesterol production. This effect is especially strong in seniors, who often have impaired cholesterol metabolism. 78-year-old Mr. Ronald Jones collapsed from acute myocardial infarction after eating fried eggs every morning at 6 a.m. Tests showed his cholesterol levels were twice the normal range. He thought he was eating eggs for his health, but it ended up damaging it. Another problem is that digestion isn't fully active in the early morning. The gastrointestinal tract has been resting overnight and takes time to get going. Protein-rich eggs can be hard to digest at this time, causing indigestion, bloating, or heartburn. It's best to eat eggs between 2 p.m. and 4 p.m., when cholesterol synthesis is lowest. At this time, digestion is fully active, nutrient absorption is more efficient, and liver activity is optimal for cholesterol metabolism. Always eat eggs with vegetables. The fiber in vegetables reduces cholesterol absorption. Broccoli, spinach, and onions are particularly good combinations with eggs. Fiber helps excrete cholesterol from the intestines, and antioxidants in vegetables support blood vessel health. Eggs should also be avoided right before bed. Protein digestion requires energy, which can interfere with restful sleep. Nighttime is when the body focuses on recovery, not digestion. If you need morning protein, try tofu or Greek yogurt. They're easier to digest and still rich in protein. What time of day do you usually eat eggs? If you've been eating them early in the morning, consider changing that habit. Fifth, cooking eggs in high temperature. Oil-fried eggs are a popular choice. But cooking eggs in high-temperature oil can denature the proteins, making them harder to digest and irritating to the stomach lining. Egg protein is very sensitive to heat. Cooking at temperatures above 212 degrees alters the protein structure, making it harder for digestive enzymes to process. This puts extra strain on digestion, especially for older adults with weaker stomach function. An even bigger concern is the harmful substances created during high-temperature cooking. When oil exceeds its smoke point, toxins such as aldehydes and acrylamide are released. These not only irritate the stomach lining, but also increase inflammation and oxidative stress. High heat also destroys choline, a vital nutrient in egg yolks. Choline supports brain health, memory retention, and helps slow cognitive decline. Destroying it with heat is a major loss for seniors. 84-year-old Mrs. Jane Smith suffered from chronic gastritis after eating fried eggs daily. Her appetite decreased and she lost weight, but her gastrointestinal symptoms improved significantly after changing her cooking method. At first, she assumed she had indigestion, when the real issue was high-heat cooking. 82-year-old Mr. George Smith had a similar experience. He had loved fried eggs all his life, but as he aged, they became harder to digest and caused severe heartburn. Switching to boiled eggs improved his digestion and increased his protein intake. For best results, place eggs in cold water and bring them to a gentle boil over low heat for about 10 minutes. This minimizes protein denaturation and allows for better nutrient absorption. Once the water starts boiling, reduce the heat. Avoid continuous high-temperature boiling, which can over-harden the egg protein. Other excellent methods include steaming and poaching, both of which cook eggs gently without oil and preserve nutrients. Microwaving eggs is not recommended. Rapid heating severely denatures the proteins and can even pose an explosion risk. Microwaves heat unevenly, overheating some areas while undercooking others, making digestion more difficult. Adding herbs and spices when cooking eggs is a smart option. Turmeric, pepper, and parsley promote digestion and reduce inflammation. Curcumin in turmeric is particularly beneficial for brain health. If you've been enjoying fried eggs until now, consider switching to boiled eggs today.